Hello everyone, my name is Dr. Hammer.
I'm Lindsay Leonard, family nurse practitioner.
Today, let's beat insulin resistance. We're going to talk about how to use a carbohydrate-restricted lifestyle for better health. So, Lindsay, why are we doing this?
When I was in nurse practitioner school, I always was taught about the medications to treat diabetes, but nobody ever talked about lifestyle modifications to be able to help people with their metabolic health. And in doing this program with Dr. Hammer, it's been incredibly satisfying, incredibly rewarding to see people beat their diabetes and beat their insulin resistance through changing their lifestyle.
That's awesome. One of the reasons I do this is I just got kind of tired of telling my patients, you have diabetes, you're probably going to die from diabetes. My patients wanted something more, and I got tired of just saying, oh, you just need to eat better and exercise more. So we did a lot of research and understanding on how to treat diabetes and actually put diabetes into remission. So what is our mission today? We'd like to review some of the teachings from Fat Fiction, which is a video that's available on YouTube. We encourage you to watch that. We're going to talk about the current problem of insulin resistance and then how to treat the problem without medication. Lastly, we'll provide resources for success.
Dr. Hammer briefly mentioned Fat Fiction. We still recommend that you watch it on YouTube. But one of the lessons that we've learned from this video is if you increase carbohydrates in food, then it directly relates to increased obesity and diabetes in our society. If you take the fat out of food, then people have to make it taste good somehow, so the carbs are increased. And that makes it ultra-processed, which leads to many of the problems with metabolic health in our society. Blood sugar stability is ultimately achieved if you restrict carbs in your foods and then add healthy proteins and fats. And so, ketogenic diets may not be all that bad. We love this quote from Dr. Jason Fung. He's written the Obesity Code and the Diabetes Code, which we highly recommend. But the quote is, you can't throw drugs at a dietary disease and expect it to get better. That's the whole premise of our presentation. You got to having insulin resistance or diabetes through eating poorly, and so we want to fix that by eating better.
So let's talk about the problem. I'm sure many of you, if not all of you, have these two foods in your home. We call them staples, sugar and flour, both highly processed foods. The problem with sugar is there's 200 grams per cup of cane sugar, and the average American consumes 60 pounds of this per year. Now, flour, on the other hand, only has 95 grams of carbohydrate per cup, but Americans consume 130 pounds per year. Now, to put this into perspective, 1 cup of either one of these exceeds the maximum dietary recommendations, and when we want to restrict carbohydrates, we're looking at trying to get a daily consumption less than 40 grams. High amounts of processed carbohydrate consumption causes insulin resistance. And insulin resistance leads to obesity, type 2 diabetes, and many other chronic health problems. So what is insulin resistance? Your pancreas produces a hormone called insulin that is essential for life. Many of the foods we consume contain an important energy source called glucose, a simple sugar. Insulin is secreted by the pancreas in response to rising blood sugar levels and signals cells in living tissues to take up glucose for energy utilization. If excess glucose is consumed regularly, insulin resistance will eventually occur. Glucose can't efficiently be removed from your bloodstream or stored for later use. As these cells become more resistant, the blood sugar will continue to rise. This can lead to prediabetes and eventually type 2 diabetes.
So this graph shows that it's years and years of improper dietary choices that lead to worsening sickness over time. We all started in our lives at a place of good metabolic health, but then through improper dietary choices, it leads us to having insulin resistance, prediabetes, and then type 2 diabetes, and we find ourselves in a state of sickness. So I want you to answer this for yourself. Fact or fiction? Type 2 diabetes is a lifetime curse. It will only get worse over time. What do you think? Many of us may have been taught that if you have diabetes, it is a lifetime curse and you just have to treat the complications as they come. But we're trying to debunk that myth. So traditionally, diabetes has been treated with every time your A1C goes up, you have to start another medication or increase the dosage of medication. You may get the token advice from your doctor to increase your activity levels or improve your diet, but you don't really get more direction than that, so it's kind of vague. Many people are taught to keep carbs as part of a balanced diet, and in fact, many diabetic medications cause your blood sugar to go low. So in order to prevent that, you have to keep carbs in your diet. The diabetes will just get worse and worse over time, and you're going to have to deal with the complications as they come. But if you know someone with diabetes, or if you have bad diabetes yourself, you know that the complications are pretty severe. It can be kidney damage, losing a limb, losing your eyesight, so we want to prevent those from happening. It's only through intense lifestyle changes that we can bring back metabolic health. The traditional diabetes treatment that I talked about, it doesn't improve sickness. It keeps you in a sick state, but hopefully prevents complications. But it's only through the carbohydrate restriction, which is a very intense lifestyle change, that we can get people back to that state of metabolic health.
So what is the cure? Easier said than done. Stop eating all the processed carbs. Therapeutic carbohydrate restriction reverses insulin resistance. Now, carbohydrate restriction works for all of the complications associated with insulin resistance, and these include, but are not limited to, obesity, fatty liver disease, polycystic ovarian syndrome in women, high blood pressure, type 2 diabetes, high cholesterol, prediabetes, and just being overweight.
We've also seen this picture of the food pyramid. So at the bottom, there's a thick layer of breads, cereals, rices, pastas. There's fruits and vegetables, meats, beans, eggs, and nuts, and then fats and oils and sweets at the top. If you watch Fat Fiction, then you can see this is wrong. And we think we should turn this food pyramid upside down. So at the bottom, we exclude the breads, pastas, sugars, milk, corn, beans, rice. And if you look at this other example of the food pyramid, you can see that the foods included there are one-ingredient foods. You pick up broccoli at the grocery store and look at the ingredients, there's nothing else besides broccoli. So really what we're encouraging is to eat whole foods, to shop at the outside aisles of the grocery store, and you will feel so much better by doing so. Okay, so look at this picture of food sources that we're recommending. These are all whole one-ingredient foods, and if you notice, they're sources of healthy proteins and healthy fats. That's what we're wanting you to get back to.
This graph explains how the different macronutrients, carbohydrates, protein, and fat, will affect our blood sugar. As you can see on the left, carbohydrates will increase our blood sugar very quickly when they are consumed. And then our body will bring the blood sugar down also very quickly. This can be a problem, as we'll talk later, with carbohydrate cravings or sugar cravings. Next is proteins. Proteins will raise our blood sugar slightly, but it will be more gradual and it will come down more gradually over hours. And then fat, in essence, healthy fats, will raise our sugar, maybe not even at all. It will keep our blood sugar stable.
It's time to start thinking differently about the foods we have been told are healthy but actually aren't. Especially if you have diabetes, you have to cut things out that you may have thought are healthy. For example, if you look at this picture, corn or sweet potatoes or yogurt, you may have been taught that these are healthy and so you've been implementing them in your diet. However, if you're focusing on fixing your blood sugar, these things will all cause blood sugar spikes. So we have to think differently about these foods and try to avoid the ones that will be a detriment to our metabolic health.
So remember, the only way to fix your health is to make intense changes, and that's what we're going to talk about. But we need to recognize that carbohydrate addiction is real. I've felt it, I'm sure you felt it, we've all felt some type of pull or craving towards these really sweet, good-tasting foods. So, carb cravings, they can be very hard to overcome. If you say, hey, I'm going to stop eating my breads and my pastas and my cookies, how am I going to get rid of my carb cravings? We're going to have some fun and use an analogy with a raccoon. You see this little raccoon? He's your carb cravings. He's those mean little cravings that are just going to come back and haunt you. So the analogy is this. This is how the story goes. There once was a lady who had a cat. And every day she would put a little bowl of food outside on her back porch to feed her cat. Obviously, the cat was an outdoor cat. It would eat the food and do its thing. Well, unfortunately, one day the cat died. But the lady, out of habit, kept putting food out on the back porch. And every day, the food was gone. One night, she was awoken with banging and scratching and clawing at her door. She rushed to her back porch, and this is what she saw. A whole bunch of raccoons. And the analogy is this: if you feed them, they will come. If you continue to feed your carb cravings, they will continue to come and they will grow stronger and stronger over time. Now, what did this lady do? She said, that's it, no more raccoons. We've got to get rid of them. So the next night, no food. Well, guess what? All of those raccoons came back the next night. They wanted some. They were craving. The next night, again, no food was on the back porch, and about half of the raccoons came. The third night, maybe only one or two, and by the fourth night, they were gone. So, if you stop feeding them, they will quickly go away. Our experience in our clinic is that you do have to give up these very addictive sugars. And typically it takes only 3 or 4 days for those strong cravings to go away, and we promise they will go away.
So if you embark on this lifestyle, we want to talk about some tools that you can use to make sure that you're doing it correctly and doing it safely. The first tool that you can use is a CGM or a continuous glucose monitor. These are highly recommended. They're little discs that you put on the back of your arm, and they monitor your blood sugar levels continuously. It provides real feedback to what you're eating and how it affects your blood sugar. And it'll send the data directly to your phone or to an included device. We love these because every person is sensitive to different foods. So some people might get a blood sugar spike from blueberries while other people are totally fine. It'll also alert you if your blood sugar is getting too high or too low, and then you can bring it to the clinic and we can review your progress. There are 2 brands, Libre or Dexcom, and we want you to tell us if you're interested in using them and we can send in a prescription. This is an example of some CGM readings. So normally, a person with good metabolic health, their blood sugars will fluctuate between 80 and 110 throughout the day. Low blood sugars usually only happen with excess insulin, but you can see highs happen when people are eating too many carbs. So in this graph here, the one to the left, it shows someone who has blood sugars fluctuating throughout the day. At the very end of the day, they ate a high carb meal and their blood sugar went all the way up to 225 or so. And then they had a huge crash, so I'm guessing they probably didn't feel very good. The one to the right shows blood sugar stability, their blood sugar staying between 110 and 100 throughout the whole day. Now, most people who are diabetic, they check their blood sugars a few times a day with poking their fingers. And if you look at the graph on the left, there are some times where that person does have good blood sugar levels. So if they're capturing their blood sugar at those times, they're probably thinking, oh, I'm doing great, I don't have anything to worry about. However, the CGM gives us the full picture so we can see the blood sugar going super high throughout the day.
So what are some other keys to success? The first is to have the right foods on hand. Second is group support. We'll talk about that. Also, is one-on-one coaching is an option for those of you who would need further help. And lastly, following the rules. We'll talk about those. So, having the right foods on hand. Here's a list of some of my staples or things that I would say you should keep on hand. All of these are low carbohydrate options that are good to be used if you need something quickly, or if you want to combine a couple of them to make a low carbohydrate, healthy fat, healthy protein meal. For example, you could have some sliced turkey on hand with some lettuce and some cheese and have a really quick snack. I like to have a lot of different spices that don't have any sugar that I can put on my vegetables or my meats or my eggs. Cottage cheese is a great, easy snack. You can put that with a little bit of blueberries or raspberries. Most fruits are high in sugar, except the berries tend to be lower in sugar and are safe to eat.
We also wanted to touch on the power of coaching. Throughout this process, you can't do it alone. Some people try to rely on their friends or family members for help, but often those people end up enabling them to make bad choices. A coach is someone who will hold you accountable. They can answer questions and provide real-time feedback. They look at your needs objectively and unbiased. They help design a plan that is best for you and motivate you when you are struggling. They also help you stay committed to your goals with regular feedback and keep you honest and hold you accountable. If you're interested in using a one-to-one coach, ask us and we can provide you with resources that might be helpful. Another resource that we have through our clinic is a group on the GroupMe app. The group is called Dr Hammer LCHF Lovers. If you go on there, you'll find a kind and supportive group where people share recipes, ask questions, and keep each other motivated throughout this whole process.
So let's talk about the rules that you need to follow. Rule number 1, and this is so important, when you go to the store and you're looking for foods, if they have to sell to you that it's healthy, it probably isn't. So if it says low fat, low sugar, keto, etc., don't even buy it. Don't eat it, please. As Lindsay mentioned earlier, we need to eat real foods. The best are those with one ingredient. Next, don't eat anything that you don't like. You don't have to eat Brussels sprouts if you don't like them. However, one thing that we've noticed with many of our patients that do this style of eating is as they eliminate the processed foods and the processed flavorings, they notice that their palate improves. They actually like foods that are healthy for them that they typically didn't like in the past. Next, eat when you're hungry, but don't eat when you're not. The whole rule that your mom taught you when you were a kid of having to eat 3 square meals a day is actually not true. Most of us have some stored energy on us that we can go many hours and sometimes even a day without eating if we're not hungry. And lastly, avoid the starches, the whites, things like breads, sugars, potatoes, pastas, rice, etc.
We get a lot of questions about fasting, and it is very safe if it's done right. Fasting can unload fat, decrease insulin levels, and de-stress the liver. We've had patients do 18, 24, or 36-hour fasts. The key to doing this safely is to make sure you're staying hydrated, so you can implement bone broth or electrolytes while you're doing it, and then discuss with us before you get started, as we may need to pause or stop medications to make sure you're doing it safely.
So what can you expect if you start this low-carb, healthy fat, healthy protein lifestyle? What we see is what other centers around the country are seeing, even around the world, is first a reduction in or remission of all signs of insulin resistance. Many of our patients are able to achieve diabetes remission. And in fact, half of the patients that do this lifestyle are able to achieve remission of their type 2 diabetes within 2 years. On average, a patient might lose up to 30 pounds of weight in a year. What is also amazing is our patients feel so much better. They tell us that their inflammation is less, their brain fog is down. We notice that their blood pressure decreases and we're able to take them off of blood pressure medication. Their cholesterol gets better. Their inflammation markers are improving. Overall, their health improves. So, there is a plan for hope. The first thing that you need to do is commit to a carbohydrate-restricted lifestyle. It's not easy, but it's well worth it. First thing is go clean out your pantry. Get rid of the foods that are going to tempt you. Just throw them away. You don't need them. We have a checklist that we'll provide as a resource on this website. Go through the checklist. Make sure you have things in place before you start. Learn how to log or monitor your blood sugar, whether it's through a CGM or a glucometer. Use a weight scale or an impedance scale to measure your body composition. If you choose to use a coach, use your coach. Have somebody there that support you. Tell people that you know and love that you're doing this and have them encourage you in your process. Log into our GroupMe app so that you can have other patients who are like-minded participate with you. And then make sure to follow up in clinic with your provider. And always text or reach out with questions if you have any. So, what if you can't go all in? I get so many patients say, "Doc, I'm just not ready for it." It's the analogy of the tortoise and the hare. This isn't a race. You didn't get to the point of unhealth very quickly, nor are you going to improve very quickly. This takes months to years. Start right now. If you normally eat this many carbohydrates in a day or a week, try to cut it down. Even cutting it in half will make a difference. But if you want to put it in remission, you need to cut it down significantly. You've got this.